5 o'clock exactly. So, whoops, so what's this? Right. So, welcome to this online extraordinary general meeting of the Full Council. Many of you are now used to virtual meetings, but I would like to remind you once again to put yourself on mute when you're not talking. To indicate if you wish to speak, please use the raise hand option. If you are dialing in by phone, you can mute and unmute yourself by typing *6 on your phone. We go to apologies. I should like to invite the Chief Executive to read out the apologies received.
Thank you, Madam Chairman. I've received apologies from County Councillor Oates. Thank you.
Okay, announcements. There are no announcements at this meeting. In accordance with the Code of Conduct, the Full Council is informed that members have declared interests under the Code in matters on today's agenda. A list of the declarations is available for inspection. Are there any other matters relating to today's agenda that members wish to declare? No. Right. Before I ask County Councillor Ali, Councillor Whip, I have noticed that you've got your hand up, even though it was before the meeting started. Am I to assume that you still want to talk during the debate?
Yes.
Yes.
Okay, right. So County Councillor Ali, please put forward your notice of motion.
Madam Chair, before I put the notice of motion forward, I think there's an echo on my side. Hello, can you hear me?
Echo on my side as well.
Okay, I'll start again. Madam Chair, I wonder before I put the notice of motion forward, whether this is the appropriate time for you to allow a moment's silence for us to remember the 100,000 plus who've lost their lives due to this pandemic, and obviously Captain Sir Tom Moore as well in recent days. And just a request, Madam Chair, before we start the motion.
Certainly, I can certainly do that. So I'll take a minute's silence now. Thank you. County Councillor Whip, if you'd like to go ahead. I mean, Councillor Ali, I was looking at the wrong person.
Bit of a difference.
It's so late now.
You need a chocolate biscuit, Chair.
Yeah, I was looking at my list.
That's okay. Okay, I'm hoping that this motion gets unanimous support from everyone across the council, because I hope that everyone in this council will agree with this motion. This came from the email I think we all received from our chief exec, who's also the chair of the LRF, highlighting all the work that was going on around the pandemic, and also the success of the rollout and undertaken by our wonderful NHS staff and volunteers. But the point of concern was the reference to the government wanting to reduce the number of vaccinations in the north, but including Lancashire, and to move them to other parts of the country. I don't have a problem I want everyone in the country to be vaccinated, but I do not see why the success of the rollout in Lancashire should mean that we have to forsake and forego vaccinations in our county. In Lancashire, we have some of the worst health inequalities, or in parts of Lancashire, in across the whole country. We have lower life expectancies in Burnley than we do in parts of Surrey. And we have huge challenges in trying to reduce and reverse the health inequalities that our communities face. We all know someone or people in our communities who passed away due to the pandemic. I can say, as a volunteer with a funeral service in Pendle, that we've buried more people in 4 months, in the last 4 months, than we buried in the whole year previously. And to see the heartbreak that families suffer, the heartbreak that people who cannot see their loved ones or can't say their goodbyes is very difficult to take. Our communities across Lancashire have struggled with this pandemic, and we have heroic NHS staff, we have volunteers and partners, paid and unpaid carers who've done an amazing job to try and keep us all going. And I think it's our duty as elected members to ensure that all people in Lancashire who need this vaccination get this vaccination. I, as a local council, I'm sure many of you will, receive phone calls and emails and text messages from people who've got severe illnesses, who have got disabilities or have other needs, who feel they need desperately a vaccination to try and prevent getting COVID or from the impact of COVID itself. And it's very difficult to say to them, look, actually, there's a process that's being followed. It's the over 80s and then it'll be the over 70s. And there are people, and there are exceptions to that, of course. But it's very difficult to explain to them why vaccines will be removed from Lancashire and sent to other parts of the country. If there's a supply problem in the country, then we need to address that nationally. The government needs to address the supply problem and make sure that all parts of the country get jabs so that they can inoculate people across their areas. If there isn't a supply problem, I think we need to stand up for people in Lancashire and make sure that they get what they deserve. I mentioned earlier that health inequalities plays a big part, and that's one of the reasons 4 years ago that Lancashire County Council adopted the Marmot Principles, and the Marmot Principles was around making sure the resources went where there was the greatest need. And this is a clear example of why we need to have the vaccine. I will also say that I know that the Chief Executive has written already to the Prime Minister, and I'm sure others have as well. And this is not to belittle that. This is to support that this full council as a whole unanimously supports everything that our Chief Executive has done so far and stands shoulder to shoulder to say we need more resources in Lancashire. And I'll just finish off, Madam Chair, because I want to give other people the opportunity to say how they feel. I want to say that, it's only in today's on Sky that 1/3 of all coronavirus patients who needed hospital treatment were admitted in the last month. That's it's a big statement, and it sort of puts it into perspective that even though there's a vaccination program, even though all the prevention that can take place is taking place, that even then, in the last 4 weeks, 1/3 of all coronavirus patients ended up in the hospital, and that's significant. So I would urge all councillors to support this motion, show unanimity, and show that the strength of a united county council trying to get the best for the people of Lancashire. Thank you.
Thank you, Councillor Ali. And do you have a seconder?
Yes,
I'd like to second.
Sorry?
I wish to second that, Madam
Okay.
Chair.
Okay, and reserve the right to speak.
I'd like to speak on it now,
Okay.
if that would be
Right,
possible.
no, that's fine.
Okay. I believe that this government doesn't consider the lives of us Lancastrians to be as valuable as those in the south. Taking away 1/3 of our vaccines and diverting it to the south is even more evidence of this government's total disregard for Lancashire and the poorest and weakest in this pandemic. Lancashire has large areas of high inequalities with health inequalities, with life expectancy being 18 years lower than the average of leafy Surrey in some areas. Michael Marmot last year explained that the Conservative austerity agenda of the last 2 years had worsened the health inequalities of the poorest in society. The economic harm done to Lancashire over the last 10 years, and also with COVID, has increased these mortality rates in our deprived communities across Lancashire. The most affected by health inequalities are the most likely to die of COVID in Lancashire. And yet this government has decided to take away a third of the vaccines intended for Lancashire and deliver it to the south. I believe that if this government doesn't reverse its political decision to divert the vaccine away from Lancashire to the south, more of us northerners will die because of this absolute madness of this Conservative government. I ask that this council supports this motion. Thank you.
Thank you very much. County Councillor Edwards, I believe that you have an amendment, is that right?
Yes, Madam.
We're diving in and out at the moment.
I've sent it to Josh Minot for circulation. Would you like me to begin my remarks, or do we need a minute to read it? I hope that this strength.
I think probably because it's quite a long one, maybe if we have a minute to read it and then if you do your remarks.
Should be. I think it just strengthens what's already been said.
Okay, yes, County Councillor Edwards, I think you can talk to it now.
Thank you, Madam Chair. The vaccine rollout has been a national success story so far. The target was set to get the top 4 groups vaccinated by February the 15th. And when I read reports in the media that vaccines were to be diverted from Lancashire away to other parts of the UK, I, as well as the other speakers so far, were concerned, completely concerned. The amendment today builds and supports on the original motion to ask the government to confirm that this was not the case then and won't be the case in the future. Thanks to Lancashire's incredible effort, we have outperformed many areas of the UK. And so the idea of diverting vaccines away from Lancashire is disheartening and damaging. However, let's be clear, it started with media reports. And then Angie, the Chief Executive and the Lancashire Resilience Forum published a robust response, which almost immediately got the attention of a series of Lancashire MPs. Morecambe MP David Morris asked the question directly and publicly to Matt Hancock, and Matt Hancock said Lancashire will get its fair share and get enough to deliver the target of February the 15th. The reports circulating on the internet do not come from credible sources. Similarly, Lindsay Hoyle, our MP in Chorley, one of your colleagues, the Labour Party, said, I have been assured that we are not seeing vaccines redirected from our region to other areas. In fact, 90% of people in the top 4 groups in Lancashire have had their first dose of the vaccine. So it turns out that the removal of the vaccines to Lancashire simply did not happen. I think it's wrong that we make council policy based on unsubstantiated wild rumours, especially after the Lancashire Resilience Forum managed to engage senior parliamentarians to seek urgent clarity on them. So why are we having this meeting? Based on the speech that Councillor Beavers gave, I really hope that this is not just a poor man's attempt to have a bash at this government in its response to COVID in an election year. I mean, I don't think the government's done everything right. Tough decisions and mature leadership has been required, and I think the government on the whole has a record to be proud of, especially when it comes to the vaccines. Let's look around the world. There's riots in France because no one's been paid in months, whereas in the UK, there's been the furlough scheme, support for businesses. I mean, in Spain, 4% of adults have been vaccinated, 5% in Germany and Greece. In the UK, it's 19.5%. Hopefully, by the time this meeting ends, if it ever does end, we'll be up to 20%. And then obviously look at what we've done closer to home. At the Conservative-run County Council, we've ensured our care home staff and residents were the first to receive the vaccine. We've supported businesses with an economic recovery fund. We've supported our staff to work safely from home and celebrated those who've stepped up and gone above and beyond to keep our vital services going. We've kept our children safeguarded, moved our entire library service online, bought hundreds of laptops for vulnerable children, continued to invest in the quality of roads and buses to keep Lancashire moving. So I think our time should be spent seeking to find the positives of life at the moment, not making political capital in a pandemic. I've had the greatest pleasure of my life to help volunteer with the vaccine rollout, as I know councillors of all parties have done. Councillor Collins has joined me at Lancaster Town Hall and was excellent. Councillor Steen and Townley and others. And the professionalism of all of the staff, the NHS, pharmacists, Lancashire Fire, volunteers involved, that should be the standard upon which we judge all of our public services. They've stepped up. Now it's time for us to step up. Let's unite. Let's ignore the party politics. And anybody watching this doesn't care what I or any other politician says, by the way. They're just waiting for their vaccine. They're waiting for the second jab. They want the schools to be open. They want the country back on its feet. So I think our message today as a county council should be, take care of yourselves, look after each other. The light is at the end of the tunnel. Let's tell our government with one voice that we support a fair and strong vaccination programme, and then let's us go back to working hard and delivering for the people of Lancashire. Thank you, Madam Chairman.
County Councillor Edwards. County Councillor Ali, I see that you've got your hand up. I'll bring you in now.
Madam Chair, I'm just trying to be helpful. I want to accept Councillor Edwards' friendly amendment, and in the spirit it's been put forward, we need to all work together. People don't give a damn whether it's not a vaccine that's red, blue, yellow, or green, or any other colour. It's a vaccine that's there to try and save lives and reduce the risk of people going into hospital. And that's what we're all trying to do through our volunteering, through helping friends, family, etc. So I'm very happy to accept that. The only thing I would say is that ask officers, when we get the response from government, that we make that available to the public, so people are actually clear about exactly our fight to get a fair deal for Lancashire, and they know exactly what the response is.
Thank you very much, Councillor Ali. Right, so that's going to be accepted as a friendly amendment. So should we go on? So now we'll go on with the people who want to speak. So County Councillor Whip, you're first.
Thank you, Chairman. I want to pay tribute to all the public sector workers involved with the vaccination programme, the doctors, the nurses, the other healthcare staff, and all the volunteers who've been supporting them, and really praise the effectiveness of those public sector people doing the impossible when we've seen other aspects of the pandemic programme being given to the private sector and frankly failing, such as test and trace. And it's really welcome to find that those people who are skilled in this area, the public health people as well, are able to make things work. And it's just a shame that we haven't had more of that and less of the private sector messing it up. Really, really good job. I just want to go back to the reasons why Lancashire, the northwest, and indeed perhaps a lot of the north of England needs the vaccinations, and it is because of low life expectancy, huge health inequalities, and the fact that for many of us we've had 7, 8, 9 months of infection rates that have been far higher than elsewhere, and in Pendle, we've had higher restrictions since last August, and the measures put in place, we've never been free of them. So the hospitals, our hospitals have been fuller for longer. Our staff in intensive care, critical care units have been under immense stress for months on end now. And although other areas of the country have had peaks, they haven't really had that sustained pressure. So I really do think we've got a very, very strong argument for the vaccination programme to continue apace. And it's not right that residents in Lancashire should be punished for the success in vaccinating priority groups. And 2 final points. I have a meeting together with others every week with the people in the primary care networks who are administering the vaccination programme on the ground here in my borough. And they are plagued with inconsistent supplies of vaccine and irregular supplies of vaccine. They don't know from 1 week to the next what vaccine supplies they will have. And so they're not able to plan. They want to be getting on with the day job, but they're not allowed to get on with the day job. They're not able to plan to do the day job because they never know if they're going to have the vials of vaccine to continue with the work. And until at least a couple of days ago, and I don't know whether it's moved on since then, we don't know whether next week they'll be able to move on to carry on with the next priority group in terms of vaccination or not. And it really cannot continue in that ad hoc fashion. I appreciate there are limited supplies of vaccine. I appreciate it cannot be manufactured fast enough and distributed fast enough. But really, to leave those dedicated professionals in the lurch and not give them a consistency and a programme and an indication of what they will be doing 1 week to the next really isn't good enough. Madam Chairman, I support this resolution. Everybody will be crying out for vaccine. I think people in our area have got a very good case indeed in terms of all the reasons: failing health, life expectancy, and living longer with COVID-19 than many other parts of the country.
Thank you. County Councillor Collins, please.
Thank you very much. I'm just going to make sure everyone else is muted so that echo goes away. Yeah, that's it. Thank you very much. I would like to speak to support the motion as it now stands. Lancashire and South Cumbria have done an absolutely fantastic job of rolling out the vaccination programme. That has been because it's been driven locally, and it has been driven by all different organisations across different sectors. And as Councillor Edwards mentioned, I've had the absolute pleasure of volunteering at a vaccination centre, working alongside people from the NHS, other volunteers, firefighters, and Lancashire Fire Service, I think, deserves a special mention for their role in training themselves up as vaccinators and ensuring that we can be very, very proud in Lancashire of our record on vaccination. The discussion has moved on since this meeting was first requested, and I recognise that. But forgive me if I don't take government assurances at face value. Councillor Edwards, you say that you don't want this to be politicised, but any decisions we make and any way we handle any situation is political. It simply is. And let's talk about, if you don't want to talk about politics, let's talk about competence. Now, you can claim a great victory for this vaccination programme, but look at the last year of this pandemic. Look at the fact that we have over 100,000 people dead in this country. Look at the fact that we do not have an effective test, trace and isolate system still a year on. Look at the fact that in other countries, they're getting back to normal life while we're still stuck in a national lockdown, because at every single stage of this pandemic, the government have made the wrong decisions. Eat out to help out, going out of the first lockdown too soon. I've got family in Australia, in Melbourne, and we speak very regularly on Skype. And their kids are at school, mine aren't. They can have people round to their house. They can see friends, they can see family. We can't. Now, a pandemic, a global pandemic, has been top of the NHS risk register for years. We should have been prepared for this eventuality, and we were not. And whilst I praise absolutely the fantastic work that has happened in Lancashire, this has been despite the government, not because of it. And I will not let comments like the government have done a good job overall lie, because they have not. They have failed our country and they have failed the people of Lancashire.
County Councillor Greenall.
Thank you, Madam Chairman. I have a great deal of sympathy with what has just been said, and indeed from what comments made by other members. I really do have a great deal of sympathy, but we must be mindful of some other issues which are of great relevance and some concern. Overall, I've been told overall fewer than 1 in 100 people who are infected will die from COVID-19. Now, these words are not from an unreliable source, Madam Chairman. They are from an NHS leaflet, COVID-19 Vaccination, a Guide for Older Adults, that I received last week. It goes on, but those over 75 years of age, this rises to 1 in 10. Now, what this is referring to is what research has shown, which is a positive correlation exists between age, ill health, and COVID-19 mortality rates, such that even before Christmas, one of our broadsheet newspapers reported that people who are under 60 and who are healthy, they even had more chance of dying in a road accident than with COVID-19. Now, despite this, we have, as has been alluded to, a vaccination project, mass vaccination project indeed, which is targeted not only at the vulnerable 1%, but now everybody over 50, and in time, so I understand, every adult and indeed every child in the country. But why, given what the research is telling us? This was at great expense to the NHS, and I do wonder whether or not we could put that money to better use in the fight against COVID-19. Because the problem is, whilst we're being told that mass vaccination is the answer, we are also being told that masks and social distancing will continue for some time. And the reason for this is because having the vaccine does not provide you with complete immunity. Though vaccines are highly effective, there have been cases of individuals contracting the virus after they received their first dose. The vaccine will not necessarily stop the spread of COVID-19. The vaccine only protects you from the effects of the virus. And after vaccination, you may still be able to pass it on, even if you are not experiencing any symptoms. Those words too, they're not coming from an unreliable source, but from an NHS email I received last week, highlighting the need to be vigilant even after vaccination. Indeed, Madam Chairman, as Public Health England stated last month, longer-term ongoing surveillance of the disease and of those vaccinated will show whether vaccine protection is long-lasting and whether the vaccine prevents a vaccinated person from carrying and spreading the virus. In other words, we are still exploring the benefits of this vaccine, which is fine, so long as those involved are aware of and have consented to this. Now, it's, you know, as has been alluded to by the previous speaker, we cannot leave politics out of this. And in my opinion, it's been clear for some time that we have needed a mature, targeted response to COVID-19. Instead, I think our governments have responded with inconsistency bordering on incompetence and sometimes enforcement bordering on authoritarianism, both of which, as has been said before, have not only failed to stop the number of deaths from rising, but the collateral damage inflicted on the lives of millions may not be known, Madam Chairman, for years. So with this in mind,
just one moment. I have a point of order from Jennifer Mean. So.
Thank you, Madam Chair. I'd like to move that the vote be put now, please.
Okay, well, we'll think about that. Just wait a moment. But I'll just let Councillor Greenall finish.
Thank you, Madam Chairman. I understand why my colleague has just said that. Indeed, I was almost not going to speak, but because so many other people are, I was just going to basically conclude by saying, you know, yes, let us protect the vulnerable, of course, as best as we can. We are a rich and powerful country, and we should be able to target our resources to help the elderly and those with ill health. Absolutely. You know, but as for the other 99% who we are told, you know, if any of them need or want help and assistance, then we should give it to them. But as for everyone else, I think, as the previous speaker might have been alluding to, we should let them get back to their normal life, reopen their businesses, get back to school, get back to university, get on with their lives. Because 3 weeks to flatten the curve is now stretching into something which I don't think it was ever really meant to be, but something which is quite unpleasant at times. Many thousands have been lost as a result of this virus. But I'm afraid, Madam Chairman, this now concerns me that I think there is another virus stalking our land, and with this is a virus of fear. And I do not want us to allow this to become the new norm. Because as I've said before at a meeting, we need to learn to live with COVID-19. We must get back to normal. We must balance the risks and recognise that there are many other risks in our lives. So yes, I have absolutely no hesitation in agreeing with what the sentiments have been said. Let us protect the vulnerable. Let's move heaven and earth to protect the vulnerable. But let's try our best to bring this to an end before the cure becomes worse than the illness itself. Thank you, Madam Chairman.
Further on from County Councillor Mean's suggestion, how do people feel if, because it is now a friendly amendment, it has been accepted by County Councillor Ali, if we go to the vote now, I think we're all in agreement, or does anybody particularly want to make their viewpoint heard?
No, I'll put my hand down now.
Vote, Chair.
Okay.
I've got a piece of good news, Madam Chairman. I just wish I could spread that through the council. I have.
I just saying that County Councillor Ali, you as it's your well, it's not a notice of motion, but you have the right to reply. So if I hand that over to you now.
Okay, thank you very much, Madam Chair. I think previous speakers have expressed their views, both about being united as an authority and expressed that view to government, but also about they've been realistic about what's happened over the last 12 months. And there's no doubt, had government chartered a different course, a course that maybe the Prime Minister of New Zealand has chartered, where there's only been 25 deaths, and maybe if our borders had been closed earlier, if we'd taken the action that we should have done, we might not have been in this very difficult place. But there's 100,000 plus people who've lost their lives, and all of us on this call, officers, will know someone who's passed away, and we've lost officers, brilliant officers of this council, to COVID too. And I just want to finish by saying that I want to thank everyone who's a volunteer, who's a carer, who's an unpaid carer, NHS staff who work tirelessly to try and serve, try and make sure that people who end up in hospital leave hospital, and people who end up coming to a vaccination centre get the vaccination that they deserve. I just want to thank all members for their patience during this discussion, and thank them for providing a united front and painting a realistic picture of the COVID pandemic here in Lancashire. There is one other pandemic that we have to suffer with as well, is long COVID. The number of people who've had COVID and then a month later, 6 months later, they found that they've developed other health conditions. People who are still suffering from fatigue, people who are still suffering from illnesses which have debilitated them and actually has changed their lives forever. We need to remember them in our thoughts and prayers, and about how the NHS and how government needs to address those issues and provide this valuable support, both in terms of rehabilitation, but also in retraining and helping these people back into jobs once we get out of this lockdown. Thank you very much, Madam Chair.
Thank you. And I should also like to reiterate how good the follow-up programme is, because when I had COVID at the beginning of the year, I was getting phoned up every other day to check that I was okay, and they were checking on what I was doing and everything like that. So, yep, totally agree. Going to move to the vote. Shall we just take it that everybody agrees apart from, or should anybody not agree, we'll take that into account. But apart from that, we will assume that the whole of the County Council agrees.
Yes. Yes.
Yes.
Agreed.
Agreed. Okay.
Agreed. Thank you.
Brilliant. Thank you.
Agreed.
What a good end to the meeting, and see you in 2 weeks' time.
There you go.
Cheers.
Keep safe, everyone.
Thank you.
Thank you, everyone.
Take care, everyone.
Thank you, everybody. Thank you. Bye.